When you come into a job interview and you say, oh no, I'm versed in scheduling and allotting the right amount of time, then you're reassuring that person who's looking to hire you that you've had some training, you're prepared for this eventuality, and you understand some of the things that can come into play to make people unhappy or to help keep them happy within the practice. So it works to your advantage that you've been trained for that in school. Appointment management is one of the medical assistant's responsibilities. We usually do it via a software program that will come up and it will have the appointment slots already pre-timed out. Some doctors like to do this every 10 minutes, some every 15, and so on. Can be done via hard copy. Not done very often in medical offices that way anymore. You're more apt to run into that in a beauty shop, for instance. But medical offices, we're trying to go more and more electronic now. We can space out times a little differently for different types of patients. For instance, if we're seeing a patient as a follow-up to routine care that we're used to doing, they come in every 3 months, have their blood pressure, check their cholesterol, check things like that. We know it's going to be a routine visit. For those patients, typically a 15-minute appointment is plenty of time. If, however, they're coming in for something a little bit different, maybe it's a new patient visit. For a lot of practices, our doctors will say, well, you better schedule me an hour, 45 minutes to an hour for a new patient visit, because they will take a little bit longer time. They will review with them their entire medical history. They will often do a full exam, physical exam, to find out for themselves what the lungs are sounding like, and so on. So those things take a little bit more time. They're going to program that into the schedule for the day. If all that you did was allow a 15-minute segment for each type of visit, then you know within an hour usually being open for the day, you're already going to be behind. When a visit is completed, usually they wind up ending their visit at the office by stopping by at the appointment desk to set up a follow-up appointment. And that is the time when we go, okay, and it'll be a routine follow-up, so we know we can set that 3 months down the road or whatever the doctor has indicated, and we know that we can allot a 15-minute visit time that'll be appropriate. There are several different methods that are followed within the medical world for scheduling patients. For instance, if you're into a specialty practice, we may follow a format that's called clustering, where a doctor may say, okay, on the morning appointments, for instance, in an OB/GYN practice, you may say, I only want to see we already diagnosed, we know that they're here for pregnancy, and so we're doing their prenatal care. That's what we're going to see every morning. Or maybe Monday, Wednesday, Friday, he'll designate a certain time that he wants all those patients scheduled for. And then he'll take the afternoon slots and use those for routine OB/GYN appointments for PAPs and whatever else is needed beyond that for the non-pregnant patients. So that's clustering, where you're grouping them all in one time. Double booking means that I'm going to schedule 2 patients for the very same appointment time. So at 9 o'clock, I have scheduled in patient A and patient B to see the same doctor at the same time. Well, that would be a little impossible to do. But there's a point at which it could be advantageous. For instance, if we know that for patient A, the doctor's going to say, hi, how's it been, how you doing? Okay, well, I want to see how those cholesterol numbers are going, and your lab is set up so that you can actually run that in the office, then he may say, so I'm going to have my medical assistant come in and do that, and I'll be back to see you in just a few minutes when we get those results. He'll come out, tell the medical assistants, okay, I'm going to need this and this, and he'll go in to see the second patient who was also scheduled for that 9 o'clock appointment. You're taking the first patient back to the lab, taking care of running the lab, getting the results, placing them back in the original room where they were, and when you've got the results, letting the doctor know that you have those. And so that's why that can often work well. Patients will often accuse doctors of double booking when it really wasn't done. Well, you've scheduled too many people to be all here at the same time, so on and so forth. And that's because a lot of doctors and a lot of practices will also allow for walk-ins. You need to, they're your patients. Typically, in a general practice, for instance, it will be done that we will work you in, maybe where there's been a cancellation, or at the end of our morning, we have a little time set aside that we'll try and fit you in before we do our lunch break and take care of walk-ins that way. then the staff needs to be prepared for that eventuality with the addresses and names of urgent care facilities where they could go and be seen in a much quicker time frame. When you can offer that to somebody who's going, now, the pressure's off of you, you've been able to send them where they can get that immediate help that they want, and it's a win-win all the way around. One of the other techniques that's used for scheduling is called a wave, and typically it's used where we will schedule in for the first 30 minutes. We might say 9 o'clock appointments, we'll schedule 3 or 4 patients all in for that 9 o'clock slot. And as they get there, sort of a first come, first serve for that spot, and we will slide them into the rooms according to when they arrived. But we'll get them all in there for that first half hour of time, and doctor will see them. What this allows is for a little bit of time for the doctor to see a patient and say, oh, I want this test done, and be able to send you down, and then he gets to move on. And if he's moved through all of them, then he has time to go back, or he gets to move on to the next patient. And it allows them a little bit more freedom for getting some lab tests done that's in-house. There are 2 other forms that we haven't talked about for making appointments. One is called streaming, where we actually get, using our very structured appointment schedule, based upon what it is that the patient's coming in to have done. So we know that if we're scheduling for physical, we're going to allow an hour, and we set that hour aside, and nobody else is being scheduled during that time. That will be the sole focus of our doctor and the staff. Then we might say for school physicals, half hour. Doctor's one who decides all of this as to how much we're going to allow for each. They decide if a regular, quote, regular appointment is going to be 15 minutes or 20 minutes. Open hours, where no appointments are made. It is purely, door opens at 9 o'clock. First one in gets to be seen first. They sign in, we go, okay, great, into a room to go. Different practices will use different scheduling methods, and also they may change that scheduling method on different days. For instance, some doctors will do Saturday hours. They may have one doctor who only is in on Saturdays. So if you want to see that particular practitioner, you will always schedule yourself to be in on that Saturday to see that particular practitioner. I worked at a practice where we had one female, and she was only available on Wednesdays and on Saturdays. And people would just wait and go, nope, if she's not there because of something on that Wednesday, I'll come and see her Saturday, that's fine. I'll wait. But we've got to, no, that's okay. I want to see her. And they've gotten that trust built up, that personal special relationship built up with that particular doctor, so they will wait. Triage is a way of sorting out the care and who needs what level of care. It's what we do usually in an emergency situation, but sometimes we triage in a non-emergency because we will decide that a patient who is here for routine care, for instance, just to say, yes, everything's doing good, I don't have this ache and pain anymore, it went away with this medication, that person would not be the first one that we might put in front of the doctor's eyes if we've got somebody who is there with, oh, I've got this horrible pain and it hurts whenever I do this. So we're triaging as to pain level and response. And we will put that person who's not received any treatment yet and is in pain, and we want to alleviate that, probably first to be seen, even though they may have both walked in at the same time. So we try to take care of immediate pain issues right off the bat. So our medical assistants need to be familiar with the concept of triage because it makes them think and not panic and going, okay, I've got to put this in priority. Who's my worst off? This one's not screaming and yelling and I'm not seeing any breathing. That's going to be my first one. This one's busy complaining and telling me that they can't breathe, but because they're talking to me, I know they can breathe, so I better take care of my silent patient first. That's all part of triage. Missed appointments can be frustrating again because now you have a gap, but we can usually make good use of that time. But with missed appointments, we want to know why they were missed. So a staff member's job is to then take that missed appointment time, make a phone call, at least leave a message saying, oh, we missed you today, you had a 1 o'clock appointment. Now you'd already called them, a day or so earlier to remind them of that. But what if they've been drawn out of town? What if a family emergency took them out? And of course they're not going to think about calling their doctor and canceling. So they didn't get the reminder call. And now they're going to get when they get home, there's going to be a couple of phone messages, one to remind them of their appointment, and then one as a follow-up of concern saying, we're just so concerned about why you've missed. Please give us a call. We're really wanting to reschedule you, but more importantly, we want to know that everything's okay. When you can shift it and put concern into that call as opposed to accusations and anger and so forth, but when you can add that little bit, we're so concerned about, just let us know that everything's all right, and then we'll reschedule your missed appointment. That's not a problem. We always want to note that in the patient file so that we're saying we've missed this appointment. Appointments and correspondence, getting appointment reminders done, all fall under the shoulders of your medical assistants. Very important part of the job. All of it has to be documented so we have a complete record of the patient's care. Medical assistants are going to put in long hours. I'll be very, very honest with that. But it's long hours of very rewarding work.